Hello, I'm Dr. McClain. In today's video, I want to share with you what is leaky gut, what causes it, and most importantly, what you can do about it. And leaky gut, boy, is such a huge issue today. It is on the rise. More and more people are being affected by it. And I think the biggest concern with it, or the biggest connection, is to autoimmune disorders. And if you're not aware of autoimmune disorders, that's when your immune system attacks your own tissue. And there's, some people say more than 100 different types of autoimmune disorders. Some people say more than 200, but they're labeled by the areas that it affects. So if it affects your thyroid, for example, that can cause what's called Hashimoto's thyroiditis. But let's focus in on leaky gut. So if you think of leaky gut, we have this tube called our GI tract that runs from our mouth all the way down to our anus. And it's this tube, and it's our one separation from the outer world and our internal environment. So just like in your house, you've got a thermostat that regulates the temperature. And if you've got air conditioning and heating, what happens if it gets too warm? You set the thermostat, let's say 70 degrees. If it gets too warm, the air conditioner is going to kick in, bring the temperature down. If it's too cold, the heater is going to come in and bring that heat up to that, roughly 70 degrees. So in our body, there's a lot of different factors that are being regulated, but one thing is our immune system, which is designed to kill things. It's designed to kill things that are not supposed to be there. So if you think about a lot of our immune system, some people say up to 70% is in our gut. And the reason being because, again, it's our separation from the outside world to the inside world. So there's got to be a lot of protective measures there. So we have these tiny thing called junctions, these tiny little gaps in the cell wall of that GI tract that allows things to pass through that are supposed to pass through. And what happens though in leaky gut, just like it sounds, it gets a leak. So we want to think about like a net. A net's supposed to let certain things pass through and keep certain things in. That's kind of the way that our gut is. Certain things should pass into our bloodstream, but when we have leaky gut, there's things that have damaged these gaps and made these gaps too big, and now it allows things that are not supposed to pass through the bloodstream. And now the immune system starts to work overtime because it's starting to attack all these different things. It gets hypersensitive. And again, that's what can lead to autoimmune disorders. So how do you know if you have leaky gut? Well, you can be tested for that. And there's various different tests that you can do. I was just talking to a patient about this the other day, a new patient that came in my office, and he has all these different GI issues. And he said, well, I wonder if I do have leaky gut. And I'll tell you the same thing that I told him, is that yes, you can go and get tested, but I'm going to give you the same recommendations to heal, whether it's leaky gut or whatever the diagnosis is, to try to do the best you can to heal that GI tract. So if you choose to get tested, that's great. But in the meantime, don't feel like you have to wait to get a diagnosis. Sometimes I see people or patients that say, well, I'm waiting to find out about this before I do something. Well, anything you can do to improve the health of your body, to improve the health of your immune system, is only going to help you heal better no matter what the diagnosis is. I'm not suggesting that you shouldn't get diagnosed or shouldn't get blood tests, but start to move forward in improving and healing your health. So some of the common symptoms that can go along with leaky gut are, number one, a weakened immune response. And again, that goes back to the fact that the immune system just working overtime as these things are getting through these gaps and it's having to work overtime to attack these things. So over time it can become weakened. Obviously, when you have this GI upset, it can create inflammation that can lead to things like constipation and diarrhea and gassiness. Now, I can tell you, long before I ever knew what leaky gut was, I think I had at least some form of it, because I used to be constipated the majority of the time. I was really, really gassy. I had all sorts of GI issues. A lot of times I had blood on my stool, which is another trait or common symptom with leaky gut. And through these various things, I don't have that anymore at all. I don't have any issues with my GI tract other than occasional when you overdo certain foods or things like that. So this can be healed. There's things you can do. Take some work depending on how severe your case is. Other common things are things like ADHD, ADD, sugar cravings, hormonal problems like depression, anxiety. And the reason is because our gut has such an impact on our hormones. So it can, if our gut gets messed up, it can mess up our hormones and throw things off, create this imbalance and lead to these mental issues, the inability to be able to focus, skin rashes and eczema. Now the reason for that is your body, your skin is one of your largest detoxers. So it's probably trying to get these toxins out, and it's affecting, that's where the skin issues go to. And the biggest thing, again, can lead to these autoimmune disorders. Now, if you have leaky gut, that doesn't mean that you have an autoimmune disorder, that you're going to get one, but there is a large connection to that. So there's various different things that can cause it. But one thing I want to touch on before we go into the causes is keep in mind that your body's doing the right thing for the situation. I'm going to try to touch on this because your body is a self-healing, self-regulating organism. It's always trying to heal. Just like I talked about earlier, like the thermostat, we have this homeostasis, this normal that we're trying to maintain in our internal environment, but we're constantly being attacked and challenged. Just becomes the nature of our environment, especially today. So your body's having to work overtime to try to balance those things. But if you get a rash, for example, don't assume that there's something quote unquote wrong. Your body's doing the right thing for the situation. So the key shouldn't be necessarily try to get rid of the rash, is to figure out what might have caused it and what you can do to heal the body so it can heal it so it doesn't continue to come back. Because you can take drugs and do things short term that might help with the symptoms, but you want to look for a long-term solution. So even if you're going to do the medications or things like that short term, if you choose to, still look at what else you can do to help increase the healing of your body. All right, so the causes for leaky gut can be really wide. They can really vary. And this is the challenge with not only leaky gut, but autoimmune disorders. It's multifactorial. I would say it's kind of like cancer. We take lung cancer, for example. Can smoking cause lung cancer? Yes, we know that that's true. But does everybody that smoke get lung cancer? No. Does some people that never smoke get lung cancer? Yes. So we know it's not just a one-cause thing like cancer. It's the same thing with these disorders, which can make it challenging because the symptoms can vary widely from person to person, but as can the causes. So let's at least hit on some of the major ones that could potentially be it. So stress is one of the biggest ones. And it's interesting, we know that stress directly impacts gut motility, affects the junctions of the gut. And there's various different reasons for this, but I'm sure you can attest this. You've had times in your life where you got so nervous about something, you got sick to your stomach, or you got diarrhea, or different things like that, simply because you were so nervous. You had an upset stomach. Now, the reason for that is, again, your body's doing the right thing for the situation. So what happens is your body's going to divert energy when we have a fight or flight response. So even if you're stressed about maybe doing some public speaking, that's not a life or death situation, but your brain is perceiving a threat. So it doesn't know the difference between something imagined and something real. So it's getting ready for a fight or to try to run. So it's going to shunt energy away from long-term health things to give you more energy to fight or flight. So it's going to divert energy away from your immune system. It's going to divert energy away from your gut, because who cares if you can digest food right now if you're not going to be alive in 2 minutes. So it's just thinking about short term. So this immune response is not meant to be long-term, and that's the challenge today. We have these high levels of stress for a lot of people that can last a long time. We're stressed about our marriage, we're stressed about our financial situation, or our job, or our business, whatever the case may be, or gas prices, or the stock market, whatever those things can be. We get these long-term stresses that can really affect the gut, and again, can lead to this leaky gut over time. Vitamin C deficiency is kind of an interesting one. So vitamin C is important in the collagen formation. So if you're low on vitamin C, you can have things like bleeding gums, but it directly impacts these junctions, these gap junctions in the gut, and can widen those and again lead to this leaky gut. So why might you have low vitamin C? Because you're not getting enough vegetables in, cruciferous vegetables. It can be because, again, you already had gut issues in the first place and you're not digesting. Maybe you didn't have leaky gut, but you had digestive issues. You weren't absorbing the nutrients properly. If you have too high sugar levels, which means you're having too high insulin levels, that blocks the ability to be able to absorb vitamin C. Or smoking blocks the absorption of vitamin C. So a lot of times people say, well, I'm taking a vitamin C supplement, and it depends on the form you're taking. A lot of them are the cheaper forms are ascorbic acid, hopefully I'm saying that right. It's the outer layer of the vitamin C. It doesn't have the guts, the important part on the inside. So you're not getting the bioflavonoids, one of the most important components of that vitamin C. So that's a really important factor there as well. And then obviously food. So things like gluten, we know that's a big one that really can damage the gut. Not everybody's gluten sensitive, but we know it does on some level damage the gut. We have all sorts of toxins now in our environment, pesticides, herbicides, as well as the modification of our foods. When we damage foods through the processing, it's harder for our body to recognize, and again, it can lead to this leaky gut. So in general, just keep in mind, it's kind of like if, let's say you spoke English, I speak English, I speak some Spanish, but not very well. So imagine you run into somebody that only speaks Spanish, you only speak English, and you're trying to communicate. It's going to be difficult. You're not going to be able to get the message across as clearly. Maybe it's going to be miscommunicated. This is kind of like when we eat processed foods. We have 100% natural form of, let's say, an organic, totally 100% natural apple, where your body knows exactly what to do to it. Well, the more you process and package that, whether it's genetically modification, you add pesticides and herbicides to it, or whatever those things are, it's hard. Just like trying to communicate Spanish to English, it's harder for your body to recognize, and it can lead to all these different issues. So that's the challenge today with leaky gut. There's so many things that can cause it that it's really an endless list. So it's not about being perfect. It's trying to lower the load on your body, so to speak. So hopefully you don't develop it, but if you do, how to heal it. So let's talk about that next. So what do we do now to start to turn these things around? If you already have leaky gut, whether you've been diagnosed or you're just having digestive issues, constipation, diarrhea, or even if you're having hormonal issues and you're not sure if it's attached to the gut, the one good thing I can tell you is anything you can do to improve your gut function and improve the healing of your gut is going to improve your overall health. So if you're not having major symptoms in those issues, or if you're not sure it's coming from the gut, if you do natural things that are going to improve it, it's going to help you heal. So you always want to approach your health from that angle, that your body is trying to heal. It knows what to do. It just either has too much damage or it's being interfered with, and it doesn't have enough information, enough energy to do the healing. So you want to, when I say energy, it's not absorbing the food right, or you're so stressed out that it doesn't have enough energy to continue to divert to the healing. Is trying to look for survival. Okay, so you want to get away from the survival model, get more to the thrive model. There's a lot of different ways to approach that. So when we look from a medical standpoint, typically it's things like corticosteroids, which are trying to mimic cortisol in the body and trying to bring inflammation down. That's not, in my opinion, a good long-term approach to your health. There's a lot of side effects to those medications. Or we take an immunosuppressant drug. Immune system is probably already suppressed, or at least is not working the right way because it's been interfered with. So again, to my opinion, it's not a good short-term and or a long-term approach. Now, sometimes people are in such dire straits, such major symptoms, a medication short-term to get them out of that crisis, that might be a good short-term approach. But again, if you're interested in long-term health, you've got to look at doing things differently. Okay, so anything you can do to heal. So we look at things like gluten, going on a gluten or grain-free diet to try to, again, minimize the stress. Minimizing your stress levels. This is one of the biggest things, is emotional stress, job stress, long-term stressors. Do some things to bring those down. And I know that's easier said than done, but remember, it's not the stress. It's not the stress, it's your response to the stress. So you can do some things to lower your response to that stress over time. Might not happen overnight, and it takes a little bit of work, but is well worth it. So I'll put a link to the video in the description here on another video. I'll talk more specifically on things you can do to help heal that leaky gut. But please post your questions or comments here, and I'll do my best to answer those for you. And also, what else you'd like to hear more about leaky gut or other autoimmune areas, and I'll do my best to make some videos in that area as well. Otherwise, please subscribe to my page if you're liking this information, and I'll see you in the next video.